LSI 2021 at the beautiful Ritz-Carlton Laguna Niguel. It's nearly true tales of innovation. I'm your host, Benjamin Glenn. Guest is Scott Huennekens, LSI 2021. Scott, thanks for coming by.
Excited to be here.
So you had a panel today looking at SPAC, our new financial vehicle. How did that go?
I think it went very well. I mean, as I said in the talk, I think this is the most exciting time ever in life sciences and Medtech. I call it Medtech 3.0. I mean, you have all of these exciting technologies that are going through 10 times improvement, whether it's 5G, sensors, computing power, cloud, et cetera. And so it's creating all these new opportunities for medical device companies, life science companies to create entirely new products, entirely new solutions. I mean, we've got 7.5 billion people on Earth, only 2.5 billion people have access, for example, to surgery. So how do we get at solving those? Now we have some of these technologies and tools to do that and start delivering on that promise here over the next 10 years.
Well, you know, you're talking about the convergence of these technologies. You're no stranger to that. Volcano brought a couple of different things together. Are you relying on that experience?
I think Volcano was a precursor to what is happening now. What I would say about Volcano is we were kind of like Microsoft Office, and in the sense of there was Lotus 1, 2, 3, and then there was Microsoft Excel, and we had IVUS and Boston Scientific had IVUS, and then you'd argue over which one was better. We said, let's change, let's add FFR pressure, flow. We talked about crux, therapeutic catheters with imaging, and we ended up with like 25 different apps on our platform, and nobody had used that kind of language to talk about a medical device before. It was, hey, our devices do this. We said, no, we're gonna make the platform of choice for a cath lab to do all of your precision-guided therapy. So that experience of saying, hey, let's build a platform that's like Google building a platform or Amazon was one stage. And now we can take it to the next level, because I would have liked to at Volcano been able to connect out of the hospital to a cloud where, you know, Volcano reps could have overseen and drawn borders on IVUS, and or the data could have gone to the physician for quality control or training and all these other new apps. And that's where we're at now, where you can have kind of a preoperative, perioperative, postoperative continuum of a product solution that gets really, really exciting. So Volcano's kind of fed into that, and we sold to Philips. Philips is now, you know, playing that vision forward. I've gone on and, you know, worked at companies like Verb Surgical, which was with Google and J&J, to do that and creating a new category, digital surgery with robotics and connected platform with all of Google's AI and the like. And now, you know, with what I'm doing on a number of public companies, brought on based upon some of that expertise. So whether it's at Invista, you know, where we have $3 billion in revenue in dentistry, and we're moving to kind of digital dentistry, or NuVasive, we're moving to digital spine surgery with robotics and navigation, or Acutus, which is an electrophysiology AFib ablation company. Same thing, platforms that are connected. So it's an exciting time because these things just weren't possible, 5-10 years ago.
Yeah, it's interesting. Earlier today, we were talking with one of the other guests here and looking at Formula One and the way that a Formula One driver in the 70s, early days, manual, lots of driver skill. So it's all in the driver, very little in the car. It begins to change, automatic steering, the braking systems. You look at Formula One today, there's a mix. You've still got it. They're still excellent drivers, but that pit crew, the data transfer, the information they get, we started drawing out this, is that what's happening to our surgeons? We're getting more of this, I don't think we're ever gonna have, the surgeon won't have their hands, we need that human touch, I don't think we're there yet. But I certainly think that augmentation are we seeing that
Yeah,
we're
I
bringing
talked
these
about
new things?
yeah. I talked about today this pyramid of information. On the bottom is supplementary information that you can provide. Then you get into semi-autonomous features. Then you get into full autonomy. You can get 80% of the benefits just at levels 1 and 2. So level 1 is like GPS. It doesn't take over your car, but now you know you're driving the best way from point A to point B. If there was traffic or you didn't know the directions, you're going to mitigate, turn problems. Semi-autonomous is everybody can parallel park now. You push the button and you back up, or other information would be things like sensors or rear cameras where you're limiting things. But if you look at F1, it's a perfect example relative to what we were doing at Verb. You're trying to take a driver who has this set of skills and move them up. So even if you're Hamilton and you're the best driver F1 wise, you're getting a quality score on every lap, every turn. And you see the difference of how you could have accelerated earlier, decelerated later, your line, all of that stuff, which helps you get better. Those are the same kinds of things that are now possible in surgery. It's taking the same information you'd have in manufacturing to take variability out of a process with robotic manufacturing of cars, for example, and saying, hey, how do I provide that information to a surgeon? These are the right 8 steps. You're on average taking 57 minutes and have this blood loss. The standard is 47 minutes and this blood loss. Now we can show you how to get there. You see it in soccer, you see it in basketball. You're an inefficient, player. You're running, 15% more than this runner. You're covering this, less, territory. They're doing it in hockey, basketball. Those kind of performance things become possible across all, not just surgery, every single episode of care. You see it where, hey, now I can monitor, with continuous glucose. I've got a sensor, I've got a pump, I've got information in front of me. I get information about if I put in what I eat, what should be done. That information's going to me as a parent of a child that it's on a pump, it's going to the doctor. That's where I get into that kind of full solution versus before someone just made a sensor.
Yeah.
And that sensor couldn't be optimized without all those other elements into the totality of the solution. Now, there are a lot of disconnected products. So I'm working with companies like Proximy, which are connecting the different products in the OR so you can get the synergies between them. A lot like, you get the synergies on your iPhone between having GPS on there and Uber on there. I mean, there's no Uber without a cell phone. I mean, pick me up. Well, where are you? I need the GPS on the phone to tell me, I'm not going to carry my computer around and get on Wi-Fi. The Uber model just doesn't work, right? So, this technology that's coming from other places at scale can drive the cost down that we now can implement it in healthcare in a more efficient manner.
Yeah, it's very interesting to me to look back to whatever, some early digital plays within healthcare where we didn't really think about it as a thing, but it was just part of the design. iRhythm is a great example out of Stanford Biodesign.
Absolutely.
What if, you think about the shift of the care episode, Mrs. Johnson, we looked at every heartbeat for the last 14 days.
Yep.
We find nothing. How reassuring that is. It changes the whole episode of care, but you have to start with that and sort of that end in mind. Terry Burke that was her whole mantra today, begin with the end in mind. And I think we're seeing that now. Digital design has to be baked into the pie.
Yeah, and how you fit into the total solution. In my earlier kind of talk, I talked about the fact that are you an app or are you a platform? And you might be, in general, a platform where these different apps can work on you, but you as a platform may be an app in a larger ecosystem, right? And so you take that situation you mentioned. The Apple Watch is now finding different people who have different arrhythmias, which then feed into, now I'm going to put you on an iRhythm, then I'm going to put you on a more comprehensive test that you come into a physician's office. Now you're going to have an invasive procedure and diagnostic, and you're going to get an ablation for your AFib. But now we have technology to check on that after you've had the ablation to improve the result. Then you check out, now you're back on iRhythm and monitored. And then if there's a problem, you feed back into the beginning. And you have this continual kind of closed loop of service and solution. And the quality goes up and the cost goes down because you don't have the same number of procedures and repeats and the like, and the quality of life goes up.
Yeah, I think that's an interesting observation to close that loop of those would have been individual care episodes. We rewind 20 years, Those would have been individual care episodes. You'd have a company focused on one, launching
Right.
one point at a time.
Right, and that's what I would call Medtech 1.0. You make a device, you sell the device. The Medtech 2.0 was we start having computing power, right? Microelectronics, and now you could do things in imaging you couldn't done because you can make these nice images, or you can connect something. But Medtech not really connect things, but just power them to Medtech 3.0. Now it just starts with the product. That's the starting point. Now you got to figure out, how do I connect? Then how do I activate the data once I have it within an ecosystem and with other particular devices to get to that solution that you're looking for.
The other part that I've become more interested in, I'm a front end guy, early stage guy. So looking out at payers, providers, health economics, those kinds of things, value. There's also that opportunity where things that we never really talked about, because I'm going to up and out. I'm going to go up. Big strategic's going to buy me. What do I care? It's it's going to be Medtronic's problem. But now you could actually get incredible value in a company. If you think about that, you make a design and you're collecting, like I call it big good data early on. I think there's an opportunity there. We'll see a convergence of data sets that are more harmonious, I think.
Yeah, and I think you're going to have data sets from other devices, your device, and these are device performance things. These are supply scheduling. There's just quality assessments. You're just going to be able to get all these, and the sensitivity and specificity often of multiple data sets goes up when you take them all together, and you're going to see and have insights that you can't see looking at individual data sets, but then collectively together you start going, oh my gosh, with smart AI and machine learning, there's things there, and we should be doing things this way versus that way. And we move from this kind of artist model of healthcare into more of a scientific oriented, not just episode of care, but continuum of care, where these things tie together and you optimize for the patient.
The Flatiron story. Do you know about those guys? So they consolidate basically oncology. So you have so a company like Flatiron grabbing together disparate and non-useful data, consolidating it, and in the aggregate, something extremely valuable. They had a big price tag on that exit, and the value was to the pharmaceutical company that could now go in and harvest that for oncology. You think we're going to see that for medical device?
Yeah, I mean, I think what we're going to see is a lot more diagnostic information, and that's everything from imaging to liquid biopsies to other just physical information where there's a camera watching you, or you're doing little tests, and someone could tell you how your gait changed or your arm movement changed, and you're doing super tests, and you're going to have neural assessments, and any and all of these things then will feed into earlier diagnosis when you can do liquid biopsies and find cancer years ahead of time, and now we can intercede and have surgical interventions that are earlier, or as we go forward with everything with CRISPR and the like, now we can start having more personalized medicine and attacking and dealing with those cancers or genetic diseases and the like. So like I said, best time ever, because we're going to have more information, but it's more information that will feed discovery relative to therapeutic solutions. Those therapeutic solutions may be devices like surgery, or they may be, pharmaceutically oriented, or combinations or hybrids.
Yeah, what do you think about the hybrid model? Is there an opportunity for medical device to sort of have this renaissance by going in and helping pharmaceuticals with maybe better delivery, simpler delivery?
Targeted delivery, all of those things. You see it with a company, Joe Burnett, who worked for me at Volcano and their company ClearPoint in the neuro space, where they're gene therapies and deliveries, with their navigation and mapping system for pharmacologic, things in the brain. We did it at Volcano. We were the surrogate endpoint for all of the big statin trials. So they wanted to see how the statin was affecting plaque. We could measure the plaque. So, if you took your statins, then you were going to get this kind of effect. If you didn't, that statin wasn't maybe working for you. You go to something different. So I think devices and pharma can be complementary, both from diagnosis standpoint to see things better, light things up, showing images, guide things, a pharmaceutical that can guide you to the right place to intervene, which you see in surgery a lot with ICG and the like, or, actually delivery of pharmaceuticals or medical devices that diagnose things so that you use the right and appropriate pharmaceuticals as well. So it's just, again, you're creating broader solutions across platforms that weren't really possible before.
When you think about what's going on in the industry and the number of startups are bringing up, I know you're focused on the SPAC now. You've been around a long time. You're a known guy. What kind of advice do you give to
that
the
was
startups?
the nicest way of telling someone they're getting older. It was a very nice way. I like that.
You're a grizzled veteran.
Yeah.
You're back from the wars and you have all the
Yes.
scars. So what are the kinds of things that you share with, the entrepreneur that, somebody grabs you having a martini tonight and, Scott, what should I avoid? What should I do? How do you advise them today? What do you share with them?
Yeah, I was, I spent about a third of my time SPAC-wise, a third of my time on the boards I'm on, and, a third of the time kind of new technologies, some investing and looking for different things. And so, I talked this morning, in my talk about the power of mentorship and how lucky I was to get to work in this industry, because everybody seems to want to help everyone. We all have in mind, the patient. We drew our org charts at Digirad, Volcano, and Verb upside down. I'm on the bottom. I work for you. We work for patients. Playing that out further is, I work for you and you, the people who are trying to do things in this industry. So whether it was Ron Machikari, or Mike Masalam earlier in my career, these guys who are icons, a little bit of a generation ahead of me, I want to be led by the example they were. How do I play it forward for the next generation of people? First of all, I want them to be successful because I'm getting older, like you already pointed out, to help me with whatever disease states I get. But that's what I tried to convey this morning. We're helping 2.5 billion people. We got to help 7.5 billion people. And how do we democratize healthcare across Europe? So, the story I shared with them this morning were these stories about how hard it is to do, startups, the Digirad, the Volcano, and Verb, and they look, these unicorns, from the outside after they're done look like, oh, that was this straight path from here was the plan. Got on my bike and I ride to the checkered flag and collect the $200 for going past go. It's not like that. It's like this. And one of my favorites.
It's Tour de France.
Yeah.
Up and down.
Yeah, and it's painful, but it's worth it at the end. And one of my favorite phrases is, there are no bumps in the road. That is the road. And that's kind of, you embrace that as a team and say, hey, expect these things to happen. We're going to do our best to, have contingency plans and address things and mitigate the bumps, but you're going to have things that don't happen. You're going forward and you file to go public at Digirad and 9/11 happens. That's a big bump in the road. Like, you got to lay off 40% of people, or J&J cancels an agreement. You got to lay off 30% of the people. You got to regroup and do this, or Volcano, our clinical trial completely fails. We have to regroup, change the trajectory of the company. So I try and convey to them, this is normal. And, you don't get overwhelmed by that. You have to be the leader. The team's looking to you. You have to have a level of transparency. You have to be believable. You got to tell the truth. It's not, oh, everything's all rosy and don't worry about it. No, we got challenges here. Be open, honest, but give them the confidence that, we're going to raise the money. We're going to make this change in the product. We're going to get there. We're going to be successful. Show them that hero's journey, which is like every Disney movie, the call to action, the supporters. Then there's this turmoil and despair, then this gut check, and then you're back on that road. And, voila, at the end of every Disney movie, the hero is there, right? And it's funny, a lot of markets develop that way. A lot of startups go that way. But I also tell them there are times there where you go, hey, look, the technology just can't get there. Is there a way to change? If there's not a way to change, then the juice maybe isn't worth the squeeze, and you got to accept reality. And you always have to face reality, whether it's to change or to pivot and do something else. So some of the messages this morning during the talk that I shared from, all of my grisly days that you referred to.
Hey, brother, this, if you'll notice, this is not coming in brown. All right?
No, I shaved so that you couldn't tell as much.
I should have shaved. So the other part of it is you also are a board member, so that advisory part. So what about the relationship with the CEO? So what are the tips for, you've made the investment now, and now this guy, Scott, is a board member. CEO dynamics, how does CEO, what are the tips to CEOs for that? How do you treat your board member? What's a board meeting like? Any kind of advice there?
Yeah, as a CEO, I wanted the best, people on my board. I wanted, if we're going public and we have 60, 70 million in revenue, I want to take Volcano to $1 billion. So I went, Ron Machikari, who took St. Jude on that journey, or Kieran Galley, who had taken, ResMed on that journey from 100 to $1 billion, or Alex Lukianoff at Nuvasive. They're going to be harder and tougher coaches, but it's like, you want to have a great coach that's going to get the most, out of you. And that's, often what I would tell people that come to work for me. Like, it's not going to be easy. I'm going to be demanding. I'm going to be fair, but you're telling me you want to be a CEO. I'm going to help you be a CEO. And I feel very fortunate because, that was a criteria a lot of times. And I have 22 people who've worked for me who are now CEOs. And that's back to that mentoring and playing it forward. So as they're now board members, they're now CEOs with board members. I encourage them, get the best board members, utilize the board. Don't feel threatened. Be transparent and open. Face realities. You're not trying to, sell yourself to your board that you know everything. That's the way I was as a CEO to begin. It's like, if I didn't know the answer, then I'm not, I'm not, doing my job. That's not always the case. They have experiences. How do you collectively? How are you better together? And boards, they get bored if the CEO knows everything and they're not contributing. It's kind of like, that guy doesn't, or gal doesn't want to listen. They don't want my contributions. I don't want to just show up and have PowerPoint slides showed to me and then I leave. So it's, how do you engage with your board? How do you make, together you're better, back to that phrase. That's the kind of encouragement I've been giving to people. So when I'm a board member, I'm not the CEO, but I'm back at that same org chart where I'm at the bottom, patients and physicians are at the top. So I look at it as I work for the CEO. I work for his management team. It's not my job to go in and take the game-winning shot. That's Michael Jordan's job. That's the CEO's, job. My job is to try and put him in the best position to make that shot, to win, give him my best, insights and knowledge, and be helpful as much as possible. But as a board member, you're also the arbiter for the shareholders, and you have governance responsibility. If people aren't getting it done, you've got to work with them to either get them there or you got to make changes.
Those are all great insights. You got anything else you want to share with our audience?
Come to this meeting. It's a great meeting. You can't beat the weather here in Southern California in May, and just you get into the hotel here, and there's just an energy. And you leave, at the end of the meeting, I'm sure when I leave tomorrow, I'm going to be energized, just being around 300, 400, however many entrepreneurs, VCs, et cetera, all entrepreneurial spirits, all trying to change the world, all trying to make a big difference. It rubs off on you. It inspires you. And I think it makes you better as you go back to, whether that journey is as a CEO or it's an employee in a startup or, it's just, someone who's participating in trying to advance humanity, so to speak.
Thanks for coming by. It was wonderful to talk with you.
Great talking to you as well.